Hello, I'm Dr. Shruti Kate. I'm a senior consultant medical oncologist practicing for the last 13 years. I'm currently practicing in Cancer Centers of America in Nashik. Can cancer be cured? Yes, of course cancer can be cured. Cure rate of every cancer are dependent on many factors. The most important is the site of the cancer, the type of the cancer, and the stage of the cancer. If the stage of the cancer is early at the time of diagnosis, then the cure rates are high, in the tune of even 80 to 90%. But if the cancer is diagnosed late, in stage 3 or 4, then the cure rates drop to 20 to 30%. It again depends, like I said, on the site of the cancer, the type of the cancer, and also the inherent specific mutations that each and every cancer has. So friends, it is very important to note that cancer can be cured if it is detected early, and even if it is detected in a late stage, there are certain patients who will become cancer free or can be cured of cancer. It is important to take prompt treatment and complete your treatment on time to ensure that we are cancer free. Can cancer be genetic? And who should consider genetic testing for estimation of their risk of developing cancer? So 5 to 10% of cancers are hereditary. One of the non-modifiable risk factors for cancer is our heredity. If you have 2 or more first-degree relatives with cancer in your family, especially breast cancer, ovary cancer, pancreatic cancer, or prostate cancer, you should take a consultation from a medical oncologist. Especially common in women is hereditary breast ovarian cancer syndrome. So if you have more than 2 breast cancer patients in your family, or more than 1 ovary cancer patient in your family, or if you have a patient of breast or ovarian cancer who is less than 45 years of age and is either your first or second degree relative, then these are few of the indications where you should consider genetic testing yourself. Along with this, if you have a male breast cancer in your family, even then you should get yourself tested. Now there are tests which are available which can let us know if you have inherited an abnormal gene or a cancer related gene, and we can reduce your risk of developing cancer through proper screening and preventive measures.